At the moment, the unsung heroes of the war against COVID-19 all over the world are the health workers who continue to sacrifice their days and sleep just so that those who have been affected by this disease are adequately catered to. In the United Kingdom and the United States, this act of selflessness is recognized every day by members of the public and in varying measures by governments, which continue to try to please even when their efforts are being described as not enough. Here in Nigeria, the government of President Muhammadu Buhari appears determined to go the same way, with plans now in place for a life insurance policy for those leading the battle against COVID-19. To underline this seriousness, just yesterday, the Presidential Task Force on COVID-19, headed by Secretary to the Government of the Federation, Boss Mustafa, disclosed plans for additional compensation packages for health workers involved in this struggle. For a conversation around this, we're now being joined from our Abuja studio by Dr. Henry Ewunonu, spokesperson of Health Sector Reform Coalition, the umbrella body of civil society organizations and professional associations in the health sector. Dr. Ewunonu, thank you for joining us. Welcome to the morning show.
Good morning, sir. Welcome to the show.
Good morning.
Thank you, Dr. Vati. Leila, good morning.
Very good. Good morning. Well, let's go straight to business. Yesterday, the Presidential Task Force, the Minister of Finance, and also the Minister of Health pointed out that the federal government is going to adopt a number of packages, including insurance packages, all kinds of compensation, hazard allowances, to take care of the interests of health workers in Nigeria who are in the front line of this battle against COVID-19. Do you think that those steps will go far enough to show appreciation and to further protect health workers who are making a heavy sacrifice to be able to help Nigeria out of this crisis? Or do you think that there are certain gaps that need to be filled in terms of, how the health sector is engaged in this war?
Well, thank you, Arise Television, for giving us this opportunity. Health workers, like you said in your intro, are the unsung heroes, in fact, the superheroes, helping the nation and the entire world all over to fight this unseen but very highly lethal enemy. Having said that, you need to keep these soldiers alive. They need to be strong. They need what they will work with so that they work well. We thank the government for voicing it out that they are considering this. You mentioned gaps, and I want to reiterate that the first case of COVID-19 was diagnosed in Nigeria on February 27th. From February 27th to now, we are about the 5th, 6th week of this infection. If as the government has declared it a war, the government has been calling it a war, a battle, and so on. So if it is a war, and it's taking us 5, 6 weeks to come up with incentives, with those things that need to prepare these soldiers and make them to fight better, to be strong in the war front, you will reserve the score you will give the government. So we want them to expedite action. How long does it take to work out an insurance package? How long does it take to make sure there are available protective equipment? How long will it take to flood the hospitals? And you see, when we are talking of the front lines, I think we are making a mistake. Because from last week, there is an evidence that we are now in the phase of community transmission. Meaning that right from the primary healthcare center, every doctor, every nurse, every community health officer, every health worker is potentially exposed So every health worker is at the forefront, the front lines of this battle at the stage we are in now, because this virus is now in the community. So we shouldn't just be concentrating on less than 1% of the healthcare workforce that are in isolation and treatment centers managing cases that have tested positive. So the package should be there should be a baseline for all healthcare workers in Nigeria that are actively practicing. Those who are in offices, not in the hospitals, is a different case. In addition to this, then the healthcare workers attending to COVID-19 patients should have something extra. So we appreciate them, but we want them to speed up this process. Let this week not go without them making a release in this. And again, we will appeal to them to plan with the healthcare workers themselves. There are groups into professional associations. They will tell government, this is the problem we have. For instance, the healthcare worker that have no means of transportation to come to work. You can pay him anything, any amount. But he still suffers that difficulty of jumping from looking for one bus or one taxi to come to work. We should be asked, what are the real issues we are confronted with during this, especially in this time of lockdown? How can they be mitigated? What do we think in our own, based on what we have observed so far? What can we do to make life easier and better for you? So, as they're planning, let it not be planning at the high places. Let them come down, let them dialogue with the health workers themselves. It's not as if we're dictating to them, we appreciate them for what they're doing, but would they need our input?
Certainly, Doctor, you've raised some brilliant points here and some very necessary points that I hope the government takes into account, especially the fact that they actually have to liaise with healthcare workers to look into the gaps and see how they can fill them properly. Now, Doctor, in the course of this conversation, we're going to be speaking a lot on this new development by the government for frontline healthcare workers, but I wanted us to also discuss something quite unique here. So if we're looking at the COVID-19 outbreak in Nigeria, for example, we've recorded 343 cases, but we've only recorded 10 deaths and we've had 91 people discharged, which is quite good news in the grand scheme of numbers here. Do you see any difference between the COVID-19 virus that we're seeing over here in African countries and the COVID-19 virus that we're seeing in the West? Or do you think that there is no correlation between that? What's your take?
Well, the presenting features or the characteristics of this disease so far, here in Africa, we share some of these characteristics with the features that are prevalent in the West. For instance, gender. This is a disease more prevalent in males, about the ratio of 7 to 3, male to female ratio, about 7 to 3. We are seeing that in the West, we are seeing that here. Also, the elderly people in the West. Well, here, the age group, based on emerging facts so far, every system, every country is still learning. No fact has been cast in stone so far. In Nigeria, age group 30 to 50, more affected. Elsewhere, 50, 60 above. Now, pattern of mortality, out there, people with comorbidities, people who have other debilitating illnesses they are battling with, now making their immunity to be low. Here, again, the deaths we have recorded, they're more in people, mostly in people who are battling one form of ailment or another. But there is this myth, something I'll call a myth for now, that the black man is immune to COVID-19. The black man is not immune to any type of disease. When I was in medical school, we used to hear that heart attack is quite rare in the African population. Today, we now know that black people are suffering heart attack. Issues with high blood cholesterol and other blood fats. We now have them here because we are adopting lifestyles of those, where it used to be more prevalent before, we are moving less. So that is a myth. Black people could be similarly affected. However, we don't have our population pyramid here. The most populous age group is about 19.5 years in Nigeria. Meanwhile, the pyramid, at the base of that pyramid, you have more elderly people in the West than you have younger people. So, our young age, vibrant immunity. Somebody jokingly said yesterday, since we were born, we have been swimming in the ocean of germs. So germs are not strange to the black man. That, please, should not be taken out of context. Germs, they kill black man. Germs kill black people. However, what has happened is what is called herd immunity. COVID-19 is SARS-CoV-2. It's actually one of the coronaviruses, strain 7. There have been strain 1, 2, 3, 4, up to 6. Meaning that since we have been battling with germs, the suggestion is that since we might have been coming into, if you check one disinfectant in common use in most homes in Nigeria, it will tell you that this disinfectant has activity against coronaviruses. It's not to COVID-19, but related strains, relations of COVID-19 that were here before. So given all this together, here again being a malaria belt zone, what happens is that our immunity is constantly being stimulated. We have TB here working with us, and we have BCG vaccination. These have been hypothesized to help in conferring some level of immunity to the black race. However, it does not guarantee complete protection.
Well,
so
Dr.
let us
Ewunonu,
continue to adopt and practice.
Dr. Ewunonu, sorry to interrupt you. We need to take a short break. When we return, the conversation will continue. Please stay with us. We'll be right back. Welcome back to the morning show here on Arise News. Still with us in our Abuja studio is Dr. Henry Ewunonu, spokesperson of the Health Sector Reform Coalition. Now, Dr. Ewunonu, thank you very much for staying with us. You were raising a number of points about strains of coronavirus, and you made a number of public enlightenment points. I don't know whether you want to continue with that. If you want to, that's fine. But then I would like to draw your attention to the nationwide broadcast by President Buhari yesterday. In that broadcast, President Buhari extended a lockdown in Ogun, Lagos, and the Federal Capital Territory. Do you think that that extension is a good idea? And do you think that it should have been, extended, really, to cover some other states of the country, considering that we have 19 states that are already affected, that have cases of COVID-19? And then I recall that a few days ago, when some state governments decided to relax the restrictions, particularly with regard to Friday prayers and Easter festivity, the Nigeria Medical Association had cautioned that there should be no relaxation of the restrictions at all. And I think also your group, the Health Sector Reform Coalition, also protested. Why did you protest? Because some people are saying lockdown is un-African, and that we should find African solution to this problem.
Let me start with the president's speech last night. We appreciate him for speaking with us once more. The extension of the lockdown was necessary, very, very necessary. Actually, our expectation was that given the first 2 weeks would have been used to conduct a research on how to make future lockdowns or extensions bearable for the people. I am not at the level of the Presidential Task Force, so I don't know what they have done or what they have not done. If they didn't do that, given the hue and cry of the people concerning unbearable economic hardship they are facing in these states where lockdown has been implemented, that's not good enough. Because if people are locked in their homes, they don't have food to eat, they don't have money to use in providing basic necessities of life, that is now imprisonment. That is incarceration. They will not they will want to enjoy a day and perhaps die. So we expect that government statements shouldn't just come, the policy statements should be informed by evidence. And how will evidence come? Through research. If the research was not done, bad. So let the research start today. That brings me to another point. Of all the policy statements made so far by government, how many of them were products of research, background checks? Having a comparison of what we have witnessed outside this country and our basic, our peculiarities as a people. We don't see the input of the academia so much so far in this fight, and we bemoan that. We have professors of community medicine, professors of public health, sociologists, professors of sociology here and there. This is a time for them to come together. We should have a crack team informing the technical, as part of the technical working group of the Presidential Task Force. If they are and working behind the scene, fine and good, but we need to interact more with them. They need to interact with certain groupings in the society. As to why Health Sector Reform Coalition and Nigerian Medical Association raised alarm, especially last weekend, as the Easter celebrations were coming. So some governors felt, oh, this is once a year celebration, so let us open up again so that our people can go and enjoy Easter. One night or one day of celebration, given the experience of what happened in France, what happened in South Korea, what happened in India, once religious event, 2,500 people were infected. One woman in South Korea infected more than 1,500 people. We should think about it. That was why we raised an alarm. Because we know the health system is weak. Because we know our people are poor. Because we know the health facilities are not there. Because we know government has confessed that they were not prepared. The preparation was poor. Even at now, we are depending on donations. Up till now, because any money to be spent by government should be from appropriation. National Assembly has not appropriated any fund to fight COVID-19 in Nigeria. So we're all donor dependent. So given all this, we said no. The low-hanging fruit to pluck here is to please appeal to these governors. Lock everywhere up again. Use technology. Find a way of facilitating that people celebrate and pray. If it is God we are praying to, God is everywhere, His Spirit is everywhere. He will see us wherever we are praying. So that was the appeal. And we thank the governors that started rescinding their earlier statements. It's not easy for a governor who has gone to make a state broadcast to come to cancel whatever and rescind on that decision. We appreciate them. We thank them, and we want to continue to work with them. We are also not happy about in some places, especially one state in the south, where the governor said, "Oh, if you wear cloth mask, you can step down on social distancing." That is not from evidence of science. That is not scientifically backed. That will spell doom for that state. So we are appealing on that governor. Yes, you want to promote the state's garment factory that is now producing cloth masks. Fine and good. You can still promote this. You can make it a fad. You can even later, during the year, when you do your celebration, it can be part of the fashion. Make it, fashion fad. But for now, please, social distancing. It has worked in other places. It has worked here. It keeps on working in many places. It will continue to work.
Thank you, Doctor. Now, for the sake of time, I'd like to get your take on something topical at the moment. We recently heard of the Nigeria Medical Association and quite a couple of other groups. Namely, we heard about the National Orientation Agency, the Nigerian Association of Resident Doctors, the Trade Union Congress of Nigeria, and the NUJ, etc., taking a stand against the team of Chinese experts or advisors that were brought into Nigeria by the CCECC Chinese company to help and give advice with regards to the COVID-19 outbreak in Nigeria. Now, although the details have not fully been released to us and there are still certain things that need to be cleared by the government, what is your take and what is the take of the Health Sector Reform Coalition on this recent development?
The Health Sector Reform Coalition joined other Nigerians. Almost every Nigerians were on the same page. It's just the federal government that was on the other side. Health Sector Reform Coalition joined Nigerians in saying, let us be circumspect in receiving whatever aid coming from China. This is not just sharing the conspiracy theory. It is because of some observations seen in other climes. This could be overreaction. This could be panic, out of panic. But the panic, the overreaction is part of one of those characteristics of human beings we studied right from years of elementary science. Irritability. That is one of the characteristics of human beings, being able to react to situations. These people who went to this country, the cases, the escalation, there was escalation. They went to another country, people started dying in numbers. They were not proved. These were observations that were not scientifically proved to the arrival of the Chinese. If we had information, correct information from the very start, government calling non-state actors, state actors, especially the healthcare industry professionals, to say, this is what we want to do.
On that note,
this is why we want to do it.
On that note, thank you very much, Dr. Henry Ewunonu. Thank you for joining us this morning on The Morning Show.